Hi, good evening. Welcome to the Whole Healing Radio Show with me, your host, Dr. Amy Dayries. I'm a dentist in Roswell, Georgia. And tonight's guest is Dr. Harvey Shiffman, who is of Boynton Beach Laser Dental Clinic in Boynton Beach, Florida. Dr. Shiffman is in general practice at the Laser Dental Center in Boynton Beach, Florida. He's a graduate of Georgetown University School of Dentistry and completed a general practice residency at Georgetown University Medical Center with an emphasis on treating the medically compromised patient. Dr. Shiffman completed certification with the Academy of Laser Dentistry, ALD, in 3 types of laser systems and was recently awarded a fellowship in the ALD. He is personally involved in the use and development of cutting-edge technology and has performed tens of thousands of laser dental procedures over the last 16 years. Dr. Shiffman is an instructor for the Academy of Clinical Technology, ACT, LHHA Lasers and Health Academy. Dr. Shiffman most recently lectured at the Rocky Mountain Dental Conference, Yankee Dental Congress, the Greater New York Dental Meeting, Rocky Mountain Dental Conference, and American Sleep and Breathing Association, Seattle Study Club Symposium, and at the 2018 Lasers and Health Conference in Portoroz, Slovenia, on advances in laser dentistry. Dr. Shiffman is an adjunct professor in the Department of Prosthodontics at Nova Southeastern College of Dental Medicine. So without further ado, I'd like to welcome Dr. Harvey Shiffman. Hi, thanks for coming on tonight. A lot of intro.
Thank you very much. Thank you for the invitation.
Yes, and you're really quite a pioneer in our industry, in the dental industry, and you do a lot of teaching to our colleagues throughout the world, really, not just the United States. But you are one of the first people to use lasers in your dental practice in so many different applications. And so I'm so privileged to have you on tonight because I wanted to introduce that topic to all the public out there so they can be aware of the new technologies in dentistry. It really makes dentistry a lot more gentle and far less invasive, and I really think a lot healthier than our older options used to be. So I wanted to talk about what all we can use lasers for, what people can ask their dentist for, and the new techniques out there that are available.
Okay. I mean, my history with lasers obviously started a little over 16 years ago. I was looking for a way to make my patient's experience more comfortable. Most people that I've come across, and I'm sure you have too, it's not their favorite thing to do.
Wow.
And so we did some research and, try to find out what it is that people fear. So people fear mostly the sound of the drill and the possibility of getting an injection. So my search was to how do we make those things better? How do we eliminate some of that anxiety that the patients have? And lasers is what jumped out at me at the time. And like you had mentioned, it was pretty early on, and there were some people doing it, and I contacted some of them, met them at meetings, and we started with a very simple laser, our first machine, which we actually still have in the office. We don't use it anymore, but we have it as a backup in case we need it. It's called a diode laser.
Okay.
Diode lasers come in different wavelengths, and they're strictly for treating soft tissue, gums around teeth, doing surgical procedures on the cheeks, the lips, the tongue, that type of thing. And also something called photobiomodulation, which I know we're going to touch a little bit more on in a little while. But so that was my first laser. And after about 6 months to a year, I was like, is that all we can do? Went out and started researching and purchased my first hard and soft tissue laser. It had 2 different wavelengths in it, very similar to the one that I presently use, the Photona Lightwalker laser. And one wavelength is attracted to the material in hard tissue like bone and teeth. And the other one is strictly for soft tissue. Again, more successful in treating soft tissues than my early diode was. More gentle, less heat, less discomfort. So, things got better and better over time and more comfortable for the patient. So probably the high 90% of our patients we do fillings with no anesthetic injections.
That's amazing.
So that fear of the injection obviously is removed. And also the fact that the laser makes a little popping sound, almost like little popcorn pops. And it's got a water spray, but it doesn't have that whining sound that people tend to fear when they think about dentists.
True.
So the combination of those 2 things really made a big difference in my practice, and just got more and more educated and continued on expanding what we were able to do with our patients. So we started doing fillings, started doing simple gum treatments, advanced to more periodontal disease treatments and that type of thing. Now, I think every single patient that comes into our practice is exposed to laser in one way or the other. Could be fillings, it could be root canal treatments, it could be periodontal, gum surgeries, assistance with extractions, disinfection of infected areas. But what I mentioned earlier about photobiomodulation which is really amazing. The first time that I saw it 16 years ago, I kind of sat back and said, okay, can that really work?
So what is that?
Now,
tell us what that is.
I mean, basically, what happens when we have an injury, all right, there's been all types of different scans done, and researchers have found that when you have an injury or an infection, your body loses energy from that area. So by putting energy back in of the correct type, it creates an environment where our body can heal itself. And it works all the way down on the individual little cells in our gums and in our muscles and anywhere in the body, really.
Yes.
And it helps those cells turn on their repair process. And photobiomodulation is the term that's currently used. And then all it is gentle, light energy of a specific type. I mean, you can't take a flashlight and aim it at your arm, and it's not going to work like that because it's not the correct kind of light. But that's all it is, and it's very gentle, and really the results are amazing. And we probably use it on almost every single one of our patients. After they've had a long procedure done, they've been sitting with their mouth open, or they may come in with a jaw problem or a muscle problem, and treat them and help relax those muscles and get them functioning again.
It can be very soothing to people too. Maybe even sort of like an anti-anxiety treatment before your dental work, and you warm up tissues a little bit.
Yeah, I mean, just the fact that you can relax those tissues, so when the patient is sitting with their mouth open for an extended period of time, makes it more comfortable for them during and after. And there's quite a bit of research being done now as far as using one of the wavelengths that's in the machine to actually create a more healthy environment in the entire body by just treating inside the mouth itself. So it's pretty interesting, and we're doing more investigation into that.
That's really fascinating. What really got me as a dentist to really want to have a laser for my patients is I had done a lot of reading on them first, and I really was intrigued by the concept of how the laser, the light, would be attracted to the dark, mushy substance, for instance, in a cavity. And I just think it's really cool imagining how the light is attracted to the darkness and in a way sort of obliterates that darkness. I think on a metaphysical way, that's pretty cool too. And in a diseased tissue, it's doing really the same thing. That's what you're talking about with the in another way of thinking about it, maybe with the photobiomodulation.
That's one aspect of it for sure.
Yeah. And then I think it's really fascinating too, the way I read it when I was reading about how does it numb teeth, or it's not really numbing teeth because there's no needle, but it's raising the pain threshold is what my understanding was about how it desensitizes a tooth where you don't have to numb a patient.
Right. Actually, what's happening is the laser light interaction with the nerves in the teeth temporarily just shuts them off. Okay. Similar to maybe what acupuncture can do. Obviously, it's different modality, but it turns off the pain fibers and makes them less resistant to that ouch sensation.
Yeah.
So
that's just really cool. It's just fascinating to me. So I've started using it. We use it for most of our restorative procedures, most of the places where you would use a drill. But it does so many other applications. You can bleach teeth with it. You can use it for even like minor facelifts, and I know you use it for something called night lace, where you're talking about treating sleep apnea or helping improve somebody's quality of sleep.
Yeah, I mean the airway issue is becoming more and more to the forefront of. I mean, you see discussions on the evening news programs about sleep apnea. People right away, they think what brings them into the office a lot of times is a snoring complaint.
Mm-hmm.
Their sleep partner, whoever that is, says, hey, you want us to stay together, you've got to do something to take care of this. And sometimes it's a blockage in the nose, or there's various different causes. But what we found with the laser is that we can stimulate new collagen in the tissue in the back of the throat,
Mm-hmm.
and tighten existing collagen so that the tissue that's in the back of the throat, the soft palate and the little uvula that hangs in the back there, tightens up and is not as flappy as it was. And that reduces the snoring and opens up the airway for better breathing through your nose. And there's a huge amount of health benefits that come from breathing through our nose versus our mouth.
Yes.
Lower blood pressure, lower blood sugar, higher nitric oxide levels, which helps with our heart, reproductive organs, all kinds of things. So it really is beneficial. Dentistry has changed so much in the last 10 years, where we're not just repairing teeth anymore,
Mm-mm.
but we're health practitioners of the body through the mouth gateway.
Yes.
Okay. So, and that's exciting for me because I've been doing this for a little while. And, if I can help a patient be healthier overall versus just, fixing something like we did 20, 30 years ago, it's a huge benefit to me and the patient. And that's our practice is totally changed into that kind of direction where we look at our patients, and I know you do too, because we've had numerous conversations. We're looking at our patients as a human being.
Yes.
Okay. And everything that we do has it affect that whole human person, and not just their teeth and their lips and kind of thing. So
Absolutely. Well, I just love all of this too. It's painless, it's non-surgical, and it's giving immediate benefit with a lot of these soft tissue procedures, and certainly with the fillings, it's immediate benefit, and they can walk out and they're not numb, so they can go eat lunch or go speak
right.
with whatever meeting they have afterwards at work. So when we get back, we're going to be cutting for a commercial break in just a minute, but maybe we could go into how this works more, maybe with the night lace, with the sleep treatment. And then later in the program, I'd like to talk about how you're doing some different other aesthetic kinds of procedures, and combining that with PRF and these other cool new things that are out there in dentistry. And then I know you're really on the cutting edge. You're on the forefront of a lot of the research that's coming out with lasers, so maybe we could also talk about some of those. So we're back here tonight with Dr. Harvey Shiffman. He's at Boynton Beach Laser Dental in Florida. His phone number at the office is 561-737-6400. And we were talking earlier about how you can use a laser in dentistry for a lot of your basic restorative procedures. If you need a filling done nowadays, a lot of times you don't have to be numb. You can just have your dentist use a laser to prepare the tooth for the filling, and it obliterates the mushy part of the tooth. It raises the pain threshold. It really nullifies the pain fibers. And so you leave and you're not even having to be numb, which is great. But Dr. Shiffman has pioneered something called night lace, and he's here to talk about that with us tonight. So maybe we can talk about airway initially and lead into why this is even a dental thing.
Sure. I guess treating sleep and airway is a team approach between the primary care physician, sleep specialists, and us as dentists, because we all have our part to try and get the patient healthy together. So night lace came about, I guess, a little less than 10 years ago, and it was actually developed by a group of gynecologists in Argentina, which is kind of a funny story that we don't really have time for tonight.
Oh, yeah, I think we have a minute. Go ahead. It's kind of funny.
They were at a conference and sharing a room, and one of the docs had a snoring problem, and the main doctor in the group was lecturing on urinary incontinence treatment using lasers, for women who had a couple of children and they had some problems with urinary leakage.
Mm-hmm.
So, jokingly, over a couple of beers was the story that I was told. they say, well, if we can help these people out, maybe we could stop his snoring. And, they treated the back of his throat and found that they were able to tighten up the collagen back there and significantly reduce his snoring. And it's come a long way since then. And we've learned an awful lot about airway too,
Mm-hmm.
as far as, general health comes from good breathing, good sleeping, because our brains, when we have good sleep, our brain repairs itself. It filters out all the bad things that have accumulated during the day.
Right.
I kind of equate it to the oil in your engine in your car. If you just keep driving that car and don't change the oil, then eventually you're going to have an engine problem.
Right.
So same thing happens with our brain. While we're sleeping, the fluid that circulates around our brain gets filtered and cleaned, basically. And so we're much healthier. There's less chance of dementias, Alzheimer's, things like that. So good sleep is really important from that aspect. And certain parts of our sleep cycle, growth hormones are developed and produced, and we store the memories of what we learned during the day.
Mm-hmm.
So good sleep is really, really important. It makes for a healthier, happier person. Our attitude is better. We have better control over pain, which is very, very interesting.
You dream again too. You're dreaming, not nightmares, but dreams. That's a sign of good sleep.
Yeah. Good dreams that you remember.
Yes.
Which means that you're sleeping well. Some older patients have, difficulties sleeping through the night because they have to get up and because of bladder issues. And patients who sleep better have less of those bladder issues too, men and women.
Mm-hmm.
So it really affects the whole body. So, sleep is really becoming a huge research area with children. Kids that snore, kids that don't sleep well, their growth and development is affected. See a lot of kids diagnosed these days with attention deficit disorder,
sure.
ADD, ADHD, bedwetting.
Sure.
And we're coming to find out that a lot of these children, they go for sleep studies and we find out that they have a sleep disorder. And just by putting them on either a CPAP machine or an appliance or the night laser treatment.
Or taking out tonsils sometimes.
Yeah, taking out tonsils. Also, the muscle attachment under the tongue with some patients can be too tight, so their tongue cannot get out of the back of their throat, so they don't breathe well when they're sleeping. So we look at all these things with our patients, but I'm really concerned with children because, 4, 5, 6 years old, they're growing very fast. Their brain is developing, their nervous system is developing. If they're not getting enough sleep, they're going to have issues. They're going to carry over, to adulthood possibly.
Mm-hmm.
So, and then there's relationships with bottle feeding versus, breastfeeding type of thing, the benefits to that as far as growing the airway,
right.
For the kids. So dentistry, like I said before, is not just drilling and fixing teeth anymore. We're looking at that whole person and how we can make them a healthier, live a long, quality of life. So, but the night lasers, so we use both of the wavelengths of laser in the machine, and there are little hand pieces that look like little tubes, and we aim the laser energy at the back of the throat, and what the patient feels is a warm towards hot sensation. I mean, if you're I tell patients, if you're a coffee drinker who takes that cup of coffee out of the machine and they want it right away and sip it, it's not any more uncomfortable than that. Okay. If you're the kind of person that waits for it to cool down a little bit, it'll be a little bit warmer than what you're used to, but it only lasts while the treatment's being done. And afterwards you just feel like, a little dry. That's about it. And it takes a couple of appointments for most people, anywhere from 3 or more, and they're about 3 weeks apart.
Mm-hmm.
And the patients all feel better. Depending on the severity of their condition would be the number of treatments that they would have to do, and periodic, touch-ups just to get back to that health that we've been able to get for them. And it really is an amazing procedure. And I was actually the first dentist in the United States that was trained to do it.
Wow, that's cool.
and we've trained, including yourself,
Yes.
about 600 dentists in the United States, in the last 7 years.
That's fantastic.
Yeah. So it's a lot of fun, both doing it and imparting the knowledge to others, and sharing the knowledge, and so that they can take that back to their practices and help make their patients more healthy. So,
Well, it's a hit. It's a hit at our practice. It's great to offer something else. We offer a lot of different tools to help people sleep better, but this is a favorite because it's pretty instant. They start noticing most of the time results that night. Everybody's different, so it doesn't mean you should be disappointed or that you absolutely should expect results the first night.
Correct.
But a lot of people do have improvement right away. It's just a great tool. It's comfortable. So.
Yeah, I mean, the alternatives for treating sleep apnea would be a CPAP machine, which is a mask connected to a hose, connected to an air pump, basically. The other alternatives would be a bite appliance, an oral appliance that goes in the mouth that moves the jaw slightly forward.
Mm-hmm.
So some people just can't tolerate those alternatives, and Nightlies works really well for them because it doesn't involve any machines or appliances. They can travel with it. They can, sleep any place, and not be a problem to, people sitting next to them on an airplane seat or something like that.
Sure. Well, that's a neat story. I think how you all figured out, or some of you all figured out how to do this. I'm glad there's people out there that are innovative.
Yeah, there's a lot of out of the box thinkers these days, involved with lasers, and huge benefits to our patients, both medical and dental.
Yes. So there's different types of lasers. The one that you are using right now, it has several all-in-one unit, which makes it pretty unique. It's the Lightwalker. But like you said, I know you've used a lot of other lasers through your career, but this one's really unique.
Yeah, I mean, I think it is. I've pretty much used every laser that's on the market presently and in the past. Some of them aren't around anymore. The company is really secure. It's over 50 years old. They make lasers for dentistry, for dermatology, for gynecology, urology. So they're pretty much across the board, medically. And one of the big fields now is aesthetics with the laser. And that's been around in dermatology probably good 10, 15 years. But the two wavelengths that are in our machine are probably the most researched wavelengths in aesthetics and dermatology, aside from just dentistry. And the reason for it is the ability to do a lot of different, procedures. So depending on what state you're in, the rules and regulations may vary a little bit.
Sure.
But I'm in Florida, and we're able to treat the face, around the mouth. And we treat wrinkles. We do hair removal with the laser, spider veins on the face. We tighten up, loose skin and wrinkles. And we actually developed a procedure that I hold the trademark on called Smooth Laze. And it's done from inside the mouth.
That's great.
So it's kind of like a sneaky kind of facelift thing where nobody really knows that you've had it done, because there's no scars, there's no redness, there's no peeling or anything like that.
Right.
And we can use lower levels of energy because the energy penetrates towards the skin easier from the inside of the mouth. The tissue is thinner and not as dense as the skin is on the face, because it's meant for different purposes.
Sure.
So the energy can go in there, stimulate the cells that form new collagen and tighten existing collagen. Because what happens with our face, from 25 years of age, we lose 1.5% of our collagen production per year. Okay. So if you start to add all that up, I'm not even going to go there, but that's what results in facial changes that we see with aging.
Sure.
Loss of volume of the face, wrinkles, sagging, that type of thing, dryness of the skin, because collagen is what keeps the moisture in our skin and keeps us looking, healthier, more vital. Okay. So with the laser, we're able to stimulate the cells that have kind of gone into a dormant phase, hibernating, so to speak. and it wakes them back up, and they start forming collagen like they did when we were 25, 30 years old. So the result is basically turning back the clock. All right, that's a term that I use with my patients, and we typically see anywhere. If you would take a photograph of yourself or myself 10, 15 years ago, I can turn the clock back and have that type of appearance by stimulating that new young collagen back in our skin. So the color of our skin is more vibrant. The elasticity is better. You know, the volume comes back to what it was when we were younger without having an artificial look.
Right. Again, no needles, no, it's not surgery. It's just.
No, it's totally non-surgical. There's no discomfort at all with it. You just feel some warmth on the inside of your cheeks. And like I said, you can walk right out. You can go play tennis. You can go have lunch with your friends, whatever you want to do. And nobody knows that you've had it done.
Yeah.
Okay. Someone recently said to me, that's like a stealth facelift or an inside-out facelift kind of thing. So there's a lot of terms that people use, but we use the same technology to tighten the skin up under the neck. Okay.
Yes.
And also to do plumping of or reshaping of the patient's lips by stimulating collagen.
You're calling that lip lace, I think.
Correct. That's lip lace. Yeah, and the neck treatment we call neck laser. Everything ends with laser for laser, but it's done from inside the mouth. So again, it's very gentle, just the laser light, no injections, no cutting or anything like that, and the patients feel better. We had a patient that we had treated. She was in her early 80s, and she said to me, every morning when I wake up and wash my face, she said, I feel like a little girl because her face doesn't feel like it's 80 years old to her, and if you could see the look on her face when she said that to me, that's a beautiful thing. If we can do that for our patients, because a lot of these patients would never go and have a facelift done. Okay. They wouldn't have surgery done, but if they have something more gentle, more natural like this done, it really, fills a niche that quite a few people need. Baby boomers, I consider myself a baby boomer. We want to look better. We want to age gracefully.
We do, and look like ourselves. Dr. Shiffman has been a pioneer using lasers for over 16 years in his practice, and he's sharing with us the many uses of lasers, and they're so much better than what we've had before in terms of drills. These are non-surgical techniques when we're using them to do things like raise the palate, stimulate collagen production in the oral musculature area, to give sort of a facelift through the mouth. You said it as an inside-out facelift. That was one of the terms you used, Dr. Shiffman. I wanted to talk about how this is really different from fillers. I think the laser will eventually replace, probably for a lot of people, the use of fillers. Fillers a lot of times stimulate the body holding water in the area where you've plumped up something. Maybe you can elaborate some on that.
Well, I mean, when you're talking about artificial filler materials that get injected into the face, so think about a balloon. All right, every time you blow up that balloon, it stretches. All right, and it gets thinner and thinner, and then you let the air out of it, and it collapses down. It's got more wrinkles in it. You got to blow it up with more air to get it nice and round and smooth. And that, unfortunately, is what happens with a lot of patients that have fillers. Every time they have to go back to redo it, and it's not permanent, it's got to be redone periodically. Excuse me. They have to put more filler material in, and what happens is they're in some cases, not all, obviously, their face starts to lose the appearance that it had previously.
Right. They don't look like themselves.
Yeah. Yeah. We have something down in South Florida we call Boca face, for Boca Raton. And if you walk around the mall, you kind of see these people. And it used to be just women, and now it's men and women. And it's probably 60-40 at this point, but we see more and more. And so that they lose that natural appearance to their face. And what we see with our patients is more and more of them don't want that. They want something more natural looking. And so we've done fillers, we've done Botox for years. We use Botox occasionally for patients who have jaw joint problems, muscle problems in the
Sure.
face. And we use something a little bit different now. Instead of the artificial fillers,
Mm-hmm.
we use something called platelet-rich fibrin. So we draw the patient's blood right in the office, we spin it in a centrifuge, and we remove the stem cells and the growth factors from that material.
Okay.
And we either inject that into the face as a filler material,
Mm-hmm.
follow it with a laser to set it, okay? And it's more natural. The body responds to it differently because it's 100% yours.
Yes,
Okay.
it's all you.
Yeah. When you inject an artificial filler, you get what's called an inflammatory response in the entire body just by putting this artificial material in.
Sure.
Whereas with the platelet-rich fibrin filler materials, you don't get that because the body says, okay, this is mine. I don't need to fight against it. So we also use the PRF platelet-rich fibrin with something called Dr. Acula's facial.
Dr. Acula's facial.
Yeah. So we laser the patient's face, and we make what are called microchannels. If you're familiar with microneedling,
yes,
on the face, well, this is similar to microneedling, but it's more accurate as far as the little perforations, the channels that are made, and then we put the PRF over that. So we get a combination effect of the laser tightening and new collagen,
mm-hmm.
and the PRF healing and stimulation of new tissue.
It looks a little bit like the person's got freckles almost when they're finished, doesn't it?
Yes.
To somebody who's listening out there.
Yeah, you see some little dots for about 5 days typically. For the first 2 days, they can't put any makeup over it. They just put on some calming lotion.
Mm-hmm.
If they have something that they typically use, botanicals, that kind of thing, they can use that. But after about 48 hours, they can put a cover-up makeup on if they want to, something organic that doesn't have a lot of chemicals in it.
Okay.
It's not going to irritate the skin. But this is becoming more and more exciting for our patients because they can get the rejuvenation. They're not using artificial materials, which a lot of our patients don't want.
Right.
And it makes them, they feel better, they look better, and who could say anything bad about that? It just, they're rejuvenated mentally and physically.
Right. It gives them an emotional lift. It's great.
Yes,
they look great.
Absolutely. So I've never met anybody that said that they wouldn't want to look better or feel better. So
I haven't either.
If we can help them, in a more natural way without using artificial chemicals or that type of thing, that's really what our focus has been probably for the last 5 years now.
Wow.
We haven't used any artificial fillers probably in 5 years. Actually, 6 months ago, we threw out a bunch of it because it expired.
Wow.
It was in the refrigerator in the office, and my dental assistant said, you know what, this is expired. And I said, well, we don't use it. Might as well get rid of it. So
yeah, that's amazing.
Yeah.
That's where I think everything's going to go. I think eventually, if people know.
Yeah, I think the more and more people are educated,
mm-hmm.
they're choosing to go that route to more natural materials that are not going to cause them any potential health risk.
Right.
Because again, just by putting the artificial materials in, you have the risk of that inflammatory reaction. And we're finding that a lot of disease is caused by inflammation.
Right.
Heart disease, coronary, vessel disease, carotid arteries, all those kind of things are inflammatory processes. So
anytime you have that inflammation going on, you're wearing your immune system down.
Correct. Yeah. So we definitely want to be moving in that direction to help keep our patients healthier and happier.
A lot of people have asked me when they've heard about these types of procedures, well, how long do they last? And they want to compare that to how long does a filler last? Mm-hmm. And it really might depend on, to some degree, which type of filler, or if it's not a filler, what type of facial procedure have you had. But some of the fillers might last as long as 6 months, and some of them might be as long as 2 years. Other types
the longer lasting materials are made out of stuff you really don't want in your body. We went through a list of them, when you attended the course mm-hmm. recently, and one of them is similar to plastic.
Right.
It's just a couple of molecules away from plastic, and the other one is similar to like plaster of Paris, so which is being injected into the face. So you definitely want to stay away from those things, again, because of the inflammatory factor. Plus, it's a foreign body that's in our skin, which is not good. So
one of the differences with the laser use and the PRF, you'll see probably more immediate results. If you were doing your smooth lace, it might be a slightly more gradual effect because your body's making collagen. Where if you use fillers, you might get more of an immediate. You walk out and you can see you're bigger or plumped up more.
Right. Yeah, I mean, some of our patients, because we have to sit down and have the conversation. It's really important. What do they want? Where do they want to be? And how long do they want to take to get there? And then we have to sit back and say, okay, realistically, realistic expectations are important, and say, okay, if you want an immediate bang for the buck as we're building your collagen naturally, then we can use the fillers from the patient's own blood products and eliminate some lines and wrinkles temporarily with that while we're building their own collagen and tightening their skin up. So more naturally.
That makes sense. Another idea you had presented is sometimes you've had people who have had fillers come in from other places. Their lips are uneven, for example, possibly. And so then you can use some of the laser treatments to sort of build up while the filler is finally coming down. That may not be put the best way.
We can speed up the breakdown of the filler, if too much has been put in. Sometimes, and we just recently had a patient who is a professional model, actually, and she had fillers done in Europe, and they put too much in on one side. So her lip was uneven.
Okay.
So in order to balance things out, like you said, while the other filler was dissipating, we plumped just a section of her lip with the laser. Okay. And in order to correct the balance, the symmetry in her lip, because, and as a professional model, her face is her business. So it's obviously very important. So, and symmetry is important too.
Yeah.
So, some of our patients come in and they say, well, I got a flat spot here, or I'd like a little more curvature. And we can create that with the laser in a non-surgical manner. It's not permanent. The laser treatments, should be touched up like every 6 months.
Okay.
Just to maintain the changes that are, occur. The smooth lace treatment that we talked about from inside the mouth, when we treatment plan, is based on the patient's age, their age and the stretchiness of their skin. I mean, if I can grab their cheek and stretch it way out to here, they're going to need more treatment to correct it.
Yes.
If they're a smoker, more treatment, that type of thing. Excuse me. If they spend an excessive amount of time out in the sun, they have sun damage, they may need a little more treatment to correct that too. So every treatment plan is different, for what the patient's need is. And what we see is that for the first couple of treatments, they may not see a lot of change. And then all of a sudden, when the collagen really starts to develop and they start seeing the changes, people will see them on the street and say, oh, you look good. Not necessarily did you have something done, which is the term that people hear sometimes, but you look good. I haven't seen you in a while. How come you don't age and I do? Is what I hear from a lot of our patients when they run into people they haven't seen in a while. So, puts a smile on your face. It's all good.
It does. I know too. When I took the course with you, you were talking to us very much about how you don't go for one treatment. You would go, for instance, let's say you want to do something with your lips, or you want to help give yourself a lift in your face or your neck. You would typically go several treatments because it's a gradual process, and you need more than one treatment. So I just wanted to reemphasize that it takes several treatments.
The lip plumping, the lip lace treatment, and it's not, when we first started doing it about 5-6 years ago, patients wanted volume. They wanted the Kardashian look or whatever other actress was in the news, and they wanted volume. And now people want something a little bit different. It's kind of changed. We still have some patients that want volume, very thin lips. They're in their 50s, 60s, and they feel that their lips are disappearing. So we give them back some volume. But they want to change the shape or balance. The symmetry that we talked about earlier is important. So we can correct symmetry. we've had some patients, excuse me, that have had Botox in their foreheads.
Yes.
And they've had too much put in, and they've got one eyelid that droops a little bit.
Oh, yes.
So we can use the laser on their skin to tighten it up to correct the droop until the Botox wears off.
That's nice.
So we've got a lot of different options.
A lot of things.
Bags under the eyes respond real well to that. The crow's feet, lower crow's feet, we can access from inside the mouth with the laser. So it's quite a bit. It's a lot of fun, actually. It has totally changed dentistry, and I've been practicing 35 years, and I still look forward to going into the office every day because I know I'm doing fun and exciting things that people are happy to have. Okay.
When we let's take another commercial break, but when we come back, I'd really like to hear your take on, especially because you're teaching to so many of us, where you see dentistry going and with respect to the lasers. Dr. Shiffman teaches to dentists at many different dental conferences throughout the United States, but also you've taught in Europe and probably some other places as well. And you also are on the faculty at Nova Southeastern College of Dental Medicine. And I would like to hear where you think lasers are going to continue to go in dentistry. And you also, I wanted to talk with you about PerformLase, and what is that?
Okay. All right. Well, let me talk about the future of dentistry. From what I see, and in the last, lasers were approved for dental use in the late 1990s, and the growth was very, very slow at the time, and it's been growing, fairly decently since then. The last 5-6 years has grown exponentially. Okay, because people are learning more about it, they're realizing the benefit to their patients, and as the population ages, with the baby boomers, the need for the patients to have treatments done, periodontal treatments, restorative treatments, removal of toxic materials that were used, amalgam restorations, all these kind of things. The laser comes into play tremendously with that because, we can a lot of times remove some of these big amalgam fillings, the mercury amalgam fillings
Right.
from the patient's tooth without even touching it with a drill. Okay, which means it stays intact. It's not released into the atmosphere. Nobody's got to, breathe it, kind of thing.
Mm-hmm.
So that's really important. The baby boomers as a whole want something different. Okay, they were brought up on drilling and filling kind of thing, and they want different technology. They want more gentle technology. Obviously, the aesthetics comes into that too. The airway health is huge.
Sure.
With our adult patients and even with kids. We examine every single one of our patients that comes into the office with what's called tethered oral tissues or tongue ties or lip ties, and you'd be amazed what percentage of people and what I learned fairly recently is that that little muscle attachment under the tongue is attached pretty much through our whole body that goes down into our abdomen and even lower. And if it's too tight, it can affect the patient's head posture and all kinds of things, muscles and their breathing too.
Yes.
And a lot of times we'll go in there, and the laser is the best tool to correct that because we can relax it and then adjust it with the laser with minimal discomfort to the patient and very fast healing. So I think even just 5 years from now,
Mm-hmm.
you're going to find at least 75% of dental offices will have some type of laser. Because lasers, if you go to an ophthalmologist, they're going to have a laser. Gynecologists have lasers.
Sure.
Dermatologists have lasers. You go into the supermarket, the scanners, and the
Everything.
checkout are all
Good point.
lasers. Yeah, so I mean the technology is really growing like crazy, and it's going to be huge in dentistry, and I can see it because when I do the lectures at the big conferences where we have a lot of doctors come in who have never touched a laser,
Mm-hmm.
the numbers who are attending these conferences is just getting bigger and bigger. So the fact that you're involved also at this point is, even though early adopters were 10, 15, 20 years
Sure.
ago, it's still a fairly new technology, and it's definitely going to go like crazy. And there are, I think, 5 dental schools that have laser programs now,
That's
full
great. I didn't know
programs with,
that.
yeah,
Yes.
where the students are actually using the lasers. And so it's pretty exciting as far as that's concerned. What you'd mentioned about the Perform laser, and that's pretty exciting because we just got the trademark, I think 2 or 3 weeks ago on that.
Congratulations. That's a
Thank
big
you.
deal.
So we're actually in treadmill testing right now with Perform laser. So what we noticed with night lasers is the patients would tell us that they were breathing so much better through their nose after they had the treatment done.
Mm-hmm.
And we had done a lot of night lasers, cases for our patients over the years, and consistently they were coming back and saying that they could breathe so much better through their nose, that their tennis game was better, they were able to bicycle faster and longer, and all this kind of thing. So I said to myself, there's something going on here beyond just treating the patient's snoring or sleep issues. So we investigated further, and we're doing what's called a proof of concept now with the
Okay.
treadmill testing. We're working with the sports medicine department in a university in South Florida,
Okay.
and we're working actually with a group of retired Army Special Forces, Army Rangers,
Neat.
and yeah, and they do Ironman triathlons. They've got a group of men and women that are involved with this, and there are test subjects. So sometime, hopefully before the end of the year, we'll have the results of the testing, and we're testing their oxygen levels before and after treatment, and with the exercise, running treadmills or biking in the clinic there,
Sure.
and they'll hook them up to all the the hoses and the wires, and do all that testing, and then we'll check their nitric oxide levels, their oxygen levels in their
Sure.
blood, and so pretty much we're pretty excited, and I think by the end of this year, beginning of 2020,
Mm-hmm.
it'll be available to to doctors who have been through the training program like yourself to provide it to your patients, and even if you're just a weekend warrior athlete and you want your tennis game better, or
Mm-hmm.
more energy swimming or running or walking, whatever, it's going to make a big difference. And I've had the treatment done myself, so I know what it feels like.
You just breathe
And
easier.
yes, yeah.
That's amazing.
So it's exciting, and it's beyond the scope of if I would have thought back to 35 years ago when I got out of dental school that I would be doing these type of things in my dental practice, I would have said, no, that's ridiculous. I'm going to be doing fillings and root canals and
Sure.
crowns and that type of thing, and that's going to be about it. But it, like we had said way in the beginning of our discussion, dentistry has really changed,
It has.
and and we're treating our entire patient, and we're enabling them, directing them towards better health and through breathing and less toxic materials and all that. I mean, there's so much innovation in dentistry to try and prevent illness
Yes.
versus just treating it once it comes around. Okay.
Wh-
So I'm very proud of that.
I am too. I much prefer the way that things are going than the way things had been. You touched on for just a second there, I think, root canals. We haven't talked about lasers with root canals, but I know in my practice, just in the last couple of weeks, I've had 3 people come in asking about that. And I'm in the Atlanta area, as you know, and I don't think we have a lot of folks that use lasers with root canals in Atlanta. But could you elaborate on what you've seen,
Sure.
with that, why you might want to seek out that type of care if wherever
The
you are, if you need one of those, if you've decided that's what you need.
Yeah, I mean, there's pros and cons when we
Sure.
discuss root canals, and I think those for some people those pros and cons were based on old technology.
Mm-hmm.
Excuse me. Where when you do a root canal, for those of you, I'm sure listeners who aren't familiar with it, you're removing either dead or infected tissue from inside the tooth. The tooth itself stays in the body,
Right.
but the soft tissue inside it is removed and sterilized and sealed. Okay. So You think of, I think I explain to patients sometimes that a tooth that's had a root canal is almost like your dining room table. Okay. At one time it was a live tree. All right. It's not alive anymore, but it's serving a function.
Yes.
Okay. And as long as we can keep it healthy and it's healthy to the person's body, then it's a good thing to have. So traditional root canal therapy involved using little file instruments and that were round
Mm-hmm.
and cleaning out something that wasn't round
Right.
as the best that we could and using, disinfectants and that type of thing, and then sealing it to keep bacteria out. Using lasers, we do something called PIP sweeps, and it creates. I'm sure almost everybody listening to the show tonight has seen jewelry in an ultrasonic cleaner.
Mm-hmm.
Okay, you go to the jeweler or whatever, and you put the jewelry in. The machine vibrates. It's got a water tank, and all the debris comes off whatever you're cleaning in the tank. So the PIP sweeps is very similar to that. It's like a photoacoustic. It's almost like a mini tornado that's happening inside the tooth. So it cleans areas where the round instruments can't go, kills bacteria, cleans those areas out. So there really is no remaining dead tissue in the tooth.
It's a whole other level of cleaning out that we didn't have before.
No. So we're actually seeing some patients who had said, never root canals.
Mm-hmm.
Now that they've learned about the new technology, they're changing their mind. I mean, some people don't, and that's okay.
Right.
But,
it's a personal choice. We're not
absolutely.
talking about that. We're just talking about if you were to have one, this is something else that the laser can do. We hadn't mentioned.
The ability to clean and kill bacteria has changed tremendously, with the laser. And the Lightwalker laser, the one that both of us have,
mm-hmm.
is the only one that's able to do this because of the way that the laser pulses. It would take an hour on its own to explain that, so we won't explain it. But
we have 1 minute left. So,
okay.
Yeah.
It has different characteristics to
mm-hmm.
it, which enables it to be able to create that little tornado in the tooth and kill the bacteria and super clean it, basically. So
it's really cool. The technology that's coming out is just amazing.
mm-hmm.
I always have buyer's remorse when I purchase something. I just do. That's just my mentality. But I did not mm-hmm. when I got my Lightwalker. It's definitely the best way to serve my patients in today's dental world, and I can offer so many more services on a much higher level than I could mm-hmm. without it. So I'm just a proud owner, but now needing to get as much training as I can. So I appreciate you coming on the show tonight, Dr. Shiffman, and sharing your wealth of knowledge. And thank you for being a pioneer.
Obviously, I like to talk about it.
Yes, well, it shows.
And it still excites me.
Yeah, I can see it's lovely. It's great to love what you do. And it's the only way to live, I think. Love what you do.
For sure.
All right. Well, thanks for coming on the show. And I will see you at the next course in January.